Hello, my name is Brandon, and I'm one of Dr. Campbell's surgical assistants. I will be guiding you through our post-operative instructions for the SkinGraft you received during your surgery with us. First and foremost, we would like you to take it very easy over these first couple of days. Surgical wounds can bleed very easily, and we want you to avoid most physical activity. Bending over, heavy lifting, pushing, pulling, straining, exercise, anything that's going to give you an elevated heart rate may cause your surgical wound to bleed. We also ask that you keep your wound elevated as much as possible for these first couple of days as well. That will help to control the bleeding and swelling to the area. We ask that you keep your wound dry for the first 24 hours. If you choose to bathe or shower within those 24 hours, please do your best to keep that wound as dry as possible. You may choose to ice your wound as well. This will help with bruising and swelling, as well as some of the dull pain that you may be feeling with it. Again, please keep your wound as dry as possible. Wrap your ice pack or bag of ice in a towel so that when you apply, if it does condensate, it will not get your wound wet. Your wound will have 2 layers of bandage. The first bandage will be a yellow Vaseline-soaked piece of gauze. Now, the purpose of this bandage is to keep your outer bandage from sticking to the wound itself. On top of this will be a pressure bandage. This consists of a rolled up piece of gauze that will be taped on there nice and tight to help control any extra bleeding. Other than icing or elevation, there's really nothing else you have to do on your day of surgery. The following morning, we ask that you remove all layers of bandages. Once you have removed everything, you will now start your vinegar water soaks. Your vinegar water mixture consists of 1 tablespoon of white vinegar with 2 cups of warm water. You'll mix that solution together in a bowl or a glass. Use a washcloth, piece of gauze, paper towel, or a cotton ball. Dip it into the mixture and then hold pressure over your wound. We ask that you soak for at least 10 minutes. If your gauze runs dry, you can re-dip. We ask that you do these soaks twice a day for at least a week. After you've soaked, we will have you apply mupirocin, which is an antibiotic ointment that we've sent you a prescription for. You may apply with a Q-tip or a piece of gauze directly over the graft itself. After applying the ointment, we ask that you cover the wound with a loose bandage. That may be a piece of gauze and a piece of tape, a smaller Band-Aid, a larger Band-Aid, or anything in between. We just ask that you keep it covered. For every soak after the very first one, once you've taken off your bandage, we ask that you go ahead and get your mixture, your gauze, and very gently wipe off the old ointment. If you do not wipe off that ointment, it will begin to layer and cake up on itself, and after a couple of days, you'll see many layers of ointment on your wound, which is not ideal. If your wound has stitches that need to come out, we ask that you perform these soaks twice daily until we see you back to get those stitches out. If all of your stitches dissolve on their own, we ask that you do these soaks for at least 1 week. You do not want a scab on your surgical wound. A big, thick, crusty scab on a skin graft might cause the graft to not take. It will also take it much longer to heal, and it will cause your scar to be worse. If at any point in the soaking process you notice that you have a scab, do an extra soak midday. Keep plenty of ointment on it and definitely keep it covered. There may be some things that you have concerns about, such as infection or extra bleeding. If your site is red, inflamed, and there's pus, you may have an infection. Please call us and let us know about that. A little bleeding is to be expected. If you have anything more significant, please apply pressure to the wound. We ask that you pinch the wound on either side, holding pressure for at least 10 minutes. Every time you release pressure, you restart the clock. Hold for 10 minutes. If it's still bleeding after 10 minutes, we ask that you do it for 15 or 20 minutes the next time. If you're still bleeding after 2 rounds of pressure, please give us a call. Your skin graft may darken a little in color over the first few days after your surgery. That is normal. Please do not be alarmed. Skin grafts tend to heal from the inside out, so the exterior portion may sometimes get a little dark. If at any point you have any concern about your wound, we ask that you call us. The instruction sheet that you were given outlining everything I've just gone over with you has our office number and Dr. Campbell's personal cell phone number. So please do not hesitate to call if you have any questions or concerns about your wound.